Well, good morning, everyone. And once again, welcome to another live this morning. Hope you're having a great day. And we certainly are. Let me say hello to a few friends before we get going here today. Michael from Norland, how are you? Eric, bonjour. Ibrahim, Portland, Oregon. Andrea, Niagara Falls. Nice to have you guys on. Rita from Wasaga. And Carrie from Nebraska. April, good morning. Mary from Norwich. And Madeleine, how you doing? Doris, how are you? Carol, West Virginia. Kathy. Sunny Port Perry. Fran, Orangeville. Georgia, from Halifax, Nova Scotia. Nick from our staff. Gary, Bolton. Margie, Kansas. Wendy from Markham. Maryland, New Brunswick. Vera, Newfoundland. Kevin, there he is, from Oshawa. Karen, from Kincardine. Verna from Markham. And Sharon from Kansas, and she's back. Victoria, how are you? And Sandra. And Heather. And Dave. Good morning. Sunny Muskoka. Yes, sunny here too. Marina. Quebec. Luella. West Tennessee. Janice. Brampton, good morning. Frida, how are you? Sue. Bolton. And Helga, it looks like. And Gloria. Yvonne. Petawawa. Sandy. And Joni. Francis, how are you from Vaughan? Couple of more. Jeanette, how are you? Carol, New Brunswick. Thanks for coming on. Wendy from London, good morning. Jeanette, how are you? And Anne, Windsor. Bruno. And Janice. Oh, Janice is saying thank you for the shout out. Jean. I was telling somebody yesterday, I don't mean to miss anybody. Sherry. Leela. And Nancy. Good morning from Gore's Landing. Nicole. Sudbury. Okay, in our backyard. Gail. And Darlene. And Arlene. How do you like that? And Catherine. How are you from Springdale, Newfoundland? We love you guys. Donna and Jean. Jean. How are you? Marianne. And Arlene. Okay, a couple more. I see, I lost it there. Dorothy. How are you from Newfoundland? Okay, let's get back to these questions. My blood pressure, Tanya is saying, is 163/60, and I'm wondering how to get it up. Well, you're talking about your second number, right? Not your first. Your first number is higher than I like. Your second number is lower than I like. But again, you know what, Tanya? Here's me, okay? I like numbers for sure. Okay, especially when it comes to blood pressure, I'm interested. But when you say, how do I get my second number up? Well, depending on how you feel. Maybe that's just you, Tanya. That's just the way you're built. And you got weird numbers. In all the years that I took blood pressure, 163/60, but it depends. I mean, low blood pressure, if you have low blood pressure, it's not just your second number, it's your first number. It would be well below 120. Okay? So you're 163 on your top number. You're 63 on your bottom number. Okay? Between your systolic and diastolic. Tanya, you're not giving me any information. I mean, how do you feel? Oh, I feel good. Well, I wouldn't worry about it. to get your bottom number up, in the vast majority of time, I'm trying to get the bottom number down, because when you look at your second number, I usually like it certainly under 90. Okay, because anything over 90 is really high blood pressure. And, I don't like high blood pressure, but one of the things you can do with high blood pressure is to make sure that you cut your sugars down. The Reset helps thousands of people over the years, has helped thousands of people over the years with their blood pressure. They go, well, I didn't do that for my blood pressure, but my blood pressure is better. Yeah, because insulin has a lot to do with that. Okay? Now, the other thing is, if you have low blood pressure, I always wanted to see numbers like your ferritin numbers and your B12, because those are red blood cells and the production of red blood cells. And perhaps you're low in that, Tanya. I don't know. Okay? So if you want, send me an email with more details, and I'll give you, maybe a better answer to that, okay? But blood pressure, let's just talk about that for a minute. It's not the salt. It's the sugar. And the first thing that I aim at with blood pressure, high blood pressure, is kidneys. And what do we talk about the kidneys? The Niagara Falls of your body. What do we talk about? Not only dehydration and water and that, but sugar, because sugar affects the blood vessels. First thing that sugar affects are blood vessels, the capillaries, and blood supply to the kidneys. High blood pressure. What did I read? Something like 50% of the population is on blood pressure medication. Is that crazy or what? But again, the first thing you got to go to is the diet, and we're carboholics. And those crappy carbs and the sugars added to foods. And I don't like that. So the first thing that we do, check that box off, is checking for kidney function and that. Low blood pressure, I look at ferritin, B12, low iron and ferritin. Okay. Helen, I'm not on any medication, but I have dry mouth. I also have an immune disorder called Sjogren's. Yeah, well, that's what's giving you the dry mouth. Sjogren's, dry mouth, dry everything. The mucus dries up. It's an autoimmune. And I always say, Helen, start with the gut. Where did Sjogren's come from originally? Leaky gut. Got to fix that. Okay? You got to fix leaky gut. So I'm big on fixing that. Get to the gut. Probiotics, obviously. And with Sjogren's, here's what I found consistently. They have a fungus. They have a yeast, the Trojan horse, got into the bloodstream. Your body reacts to that. Do not feed the bears. Lay off the sugars. I would do the reset. And for leaky gut, I would have you on probiotics. I would have you on bone broth. For L-glutamine and that, in order, all those amino acids, they help with the healing of leaky gut, and they regenerate that. And another one that I like and that I put a lot of people on was quercetin. Okay, now quercetin is really helpful in knitting that blood-gut barrier. Okay, quercetin. So probiotics, bone broth, quercetin. Okay, I would have you on those three. Okay, for sure. And lay off the sugars. Don't feed the bears. Don't feed that fungus. It's been there for a long time, probably. Guys, anytime you have autoimmune, think of the gut. It starts in the gut. Could have started the first time that a person took an antibiotic, even as a kid, and years later, because that microbiome, and I talked about this the other day, sometimes you take an antibiotic, and what do you know? You're a kid or whatever. But you know, or you have a urinary tract infection or whatever, sinus infection. You take an antibiotic, and what they've discovered about the microbiome is sometimes those, you might lose when you look at the microbiome. Okay, you got you know, trillions of bacteria, but they're usually found in tribes. Okay? And different tribes do different things. I'm talking about the good bacteria now. Okay, so you have Acidophilus, you have Bifidus, you have Rhamnosus, you have Reuteri, you have all of that, okay? Different strains, and they do different things. They protect different areas. You know, maybe I'll do a teaching on that again, okay? Because I've always been talking about broad spectrum. It's really important. But with an antibiotic at times, you can wipe out. They've shown this in studies. You can wipe out a tribe and they never come back. 5 days of an antibiotic can wipe out. They wipe out all the bacteria, good and bad. The problem is, sometimes a tribe of good bacteria, the one that's on your side, never comes back. That can cause an autoimmune disorder. Now something, you know, comes into your body that shouldn't turn your immune system on, but now it does. And your body overreacts to it. You become like allergic to yourself. And now you get an auto self-immune problem. Autoimmune. And I always started in the gut. Okay? Always start with the gut. Dry mouth. Gut. Okay? Thanks, Helen. Shay. Okay. How long does it take to no longer have insulin resistance? Well, that's a good question. Now, let me tell you this. Okay? Let me tell you this. Generally, and I'm going to say, Shay, generally 30 days. Okay? Generally. So someone that has insulin resistance, you can measure that. If you're above 5.4, and we talked about all these symptoms of insulin resistance, okay, and your blood sugar, your A1C is over 5.4, that is sort of the sweet spot. If you're over that, you've got insulin resistance. The reset was created for insulin resistance. That's why I did it with patients who had insulin resistance, okay? And let me just see here if I have some quick notes here. Let me go over that. Check engine light. I'll go over this real quickly. Okay, and again, some of these things can be other things too, but A1C over 5.4, strong indicators. Obesity, belly fat, high blood pressure, high triglycerides, low HDL, inflammation, fatty liver, acanthosis, skin. Okay, darkening of the skin in different areas. Under the armpits or in the legs. Hair loss. Could be anything. Could be thyroid, but even the thyroid. Sarcopenia. osteoporosis, Dowager's hump, ED, BPH, prostate, inflamed, hormonal imbalance. There you go. That's a big word. I mean, a big topic. Hormonal imbalance. Gout, psoriasis, memory problems. Those are high indicators, strong indicators. Okay? And there's a lot of other things in the check engine light. But the big ones, okay, are the ones that I just talked about. Those are all possible signs of insulin resistance. Get your blood work done. If your triglycerides are high and your HDL is low and you got higher A1C than 5.4, you're in doo-doo. You're on the Titanic. It's time to turn the ship around. Shay, good question. How do I know if I have insulin resistance? Okay? If I still have it, and how long does it take to get rid of? On average, 30 days. Some people, longer. Okay? But anyone that is got A1C over 5.4, them and carbs don't get along. Don't fool yourself. It's not meat. It's not eggs. It's not cheese. It's carbs. And look, it isn't fruits and vegetables either. Okay? It isn't. Now, don't drink any fruit juice. Okay? But if you have trouble and your A1C is over 5.4, you have insulin resistance. Do the 30-day reset. It's worth it. It can save your life. And I don't say that lightly, guys. I mean it. It will get you off the Titanic. So, thanks for the question, Shay. Okay, let's get back here to, thank you for Audrey. I take Navitol. I've been off balance for a while and it is getting worse. I found out that I had a punctured eardrum on the right side 2 years ago from the specialist. Well, Audrey, okay, you got a very specific problem in the middle ear. I would have put you on Navitol. If that didn't help you, well, you know, if it didn't help you within a month or two, not going to help you now. Now, Navitol will give you a lot of other good things, okay? So I take it every day because it elevates my nitric oxide. That means it opens up my blood vessels. Very good for blood pressure, okay? Very good. Navitol is a powerful antioxidant. It protects your cells. It is anti-aging. It elevates your glutathione. What is glutathione? Velcro that your body produces. And it takes toxins. And it's like Velcro to toxins and takes them out of your body, including heavy metals like mercury, lead, and cadmium, and fungus. Okay? So you want to elevate your glutathione. Navitol is very good on that. So antioxidant, nothing stronger. Okay? Nitric oxide, blood vessels, circulation. Okay? And nitric oxide energy because it opens up your blood vessels. Okay? Even in the brain. And glutathione, which is a real master detoxer. It elevates your levels of glutathione. Okay? Thanks for the question. And Audrey. And the other thing, okay, just on balance, okay, in general, okay, maybe not for you, Audrey, because you had an injury to your middle ear, but just generally, a lot of people get vertigo or whatever, and a lot of times low B12, low vitamin D. Just check it out and make sure, Audrey, it's not that. Teresa, is it true that estrogen, low estrogen, can affect your tendons in your body? Low estrogen affecting your it's not the first thing that I think of. Okay. It's not. Okay. As a matter of fact, Teresa, I'm trying to think if that's the first time I've ever heard that. Okay. So I would tell you, not really. Now look, okay. Now look at what, here's a check engine light on your insulin. Okay. Here's a check engine light. Talked about this the other day. Carpal tunnel. Achilles tendon pain. Chronic tendinitis. I would look, Teresa, far more at sugar and glycation, okay? So let me just stop for a second. What's A1C? What is it a measurement of? Sugar attaching itself to hemoglobin, okay? Your red blood cells carry oxygen, hemoglobin, right? When sugar is in the bloodstream, it attaches itself to your hemoglobin in your red blood cell. That's how they can measure it. So when it hooks its wagon to your red blood cells, we call that glycated, okay? Glycated hemoglobin. That's what A1C is. It's a measurement. And if you have lots of sugar in your bloodstream, your A1C will go up. This is why, look, you can do a fasting insulin test. I got no problem with that. But I sort of say the poor man's testing, and I always liked A1C. I always did. And that's why, like, I talk about that all the time, A1C. So what I'm saying to you, I don't really care, Teresa, about low estrogen, okay? Because generally, women don't have low estrogen. They don't. Not compared to progesterone, okay? So where I think hormone doctors, endocrinologists, and all that get this wrong is, yeah, you're getting older. Your estrogen's going down, ladies. And men, your estrogen's going up because your testosterone is going down. But guys, it's a balance. You want your estrogen and your progesterone to be equal. That's the problem, not low estrogen. Because we live in an estrogen-dominated world. Almost every chemical mimics estrogen. Why do you think we see so much breast cancer today? Okay? Why do we see so much ovarian cancer? Why do we see so much prostate cancer? It's too much estrogen. Not enough, not too low, too much. And I want a balance. I want a balance between estrogen and progesterone. Okay? Okay. Thank you very much. I don't buy it that low estrogen can affect your tendons. Much more has to do with insulin. Joseph, have you heard of the Bowen, I don't know how you pronounce it, therapy? I've heard of it. I've seen it. I don't know. You know, if someone tells you that with sciatica, if someone tells you that if you just do this, it'll fix it, I kind of get a chuckle sometimes on Facebook or YouTube or whatever it is, social media, and they say, here's a trick for sciatica. And if you just do this, you'll never, first of all, it'll cure you of sciatica and you'll never have it again. Well, you know, when someone tells you that, run. Run, Forrest, run. Sciatica. It's a terrible pain. And, like, come on. Sometimes, hey, I've fixed sciatica over the years. And I was pretty good. But, guaranteed? Nah, no, I don't buy it. So, Bowen therapy, I don't know. It's a technique. If they tell you it fixes everything, run. If you want to try it because you got sciatica, I wouldn't be against that at all. You know what I used to tell my patients? If I thought hanging you upside down from my office roof would help you, I will go up on the roof and hold your feet. And what I'm trying to say, you know what I mean? Yeah, like, I'm not against those therapies. If they help, good for you. Okay. But like I said, if someone says, I fix this every time, run. They're lying to you because they don't. Okay. Thank you, Joseph. Nick, I can't remember if I did this the other day or not. Doc, what are your thoughts on seniors needing to double up protein? Seen an article on this. Yeah, I agree with that. Seniors get very little protein on average. Okay? They're following Canada's food guide or the American food guide or the food pyramid. And they're into grains, and they're into fiber, and they're into fruits and vegetables instead of meat and eggs and protein, because they bought the lie, the cholesterol, and protein. I had it the other day, scrolling through the comments after Facebook. Well, protein is hard on kidneys. No, it's not. You know that. You guys know that. Protein's not hard on your kidneys. Sugar's hard on your kidneys. That's what's hard on your kidney. Protein isn't hard on your kidneys. At all. Okay? So, it's the opposite. And seniors don't eat enough protein. That's a fact. Okay? And neither does anybody else. We are so devoid of protein because people buy the lie of cholesterol. And cholesterol is only found in the animal kingdom. Okay? And we're going now through a whole thing of veganism and vegetarianism, and it isn't right. It isn't right. It's not true because it's not complete. Okay? So you want eggs, complete food. Meat, complete food. Cheese, complete. You think I'm kidding? I'm not kidding. Okay? So, you want to have fruits and vegetables? I got no problem with that, and I mean it. Okay? I mean it. But it's not complete. Okay? You weren't meant to live on that. Okay? So, double up on your protein, Nick. I got no problem at all. Abe. Can erysipelas, ooh, those big words, a bacterial infection on the skin be treated naturally? Well, yeah, anything on the skin, inside out. Look under the hood. Look to the gut. If you got an infection, a bacterial infection, look, it could be localized as possible. But generally, if it's chronic or whatever, look to the gut for what I talked about earlier. Usually, you got your microbiome is been affected. You want to replenish, you want to replace, and you want to regenerate. How's that for 3 R's? Replace, regenerate, replenish. I like that. Good. You do that with your Abe. Thank you with that, okay? My son has this and no help. Okay, well, you get, and put oil of oregano on your skin. Do oil of oregano, because it could be parasites too. Oil of oregano inside out. Abe. Okay? Oil of oregano. Take it. Drops. Okay? And then pray. You'll have to. Okay? That's how strong it is. Mary. No, Wanda, did I answer this? How can you lower lipoprotein A? I think I did this the other day. Hold on a minute. Let me just, you see, no, I didn't, because I did and I didn't. Kathy, my doctor wants me to do an ApoB test. Okay? Lipoprotein. And then that was B, and this one is A. Wanda, how can you lower my lipoprotein A? The first question, Wanda, I would ask, why do you want to lower it? Look, I went over this the other day. Medicine gets into the weeds. They get complicated. And they've been very successful at lowering cholesterol. They've been very successful at it. And what has that done? Let me ask you, what has that done, Wanda? And Kathy, what if you lower your lipoprotein? Why do you want to lower it? Why do you want to get it tested? They never used to test that. Now, we should test that. Why? Because of all their years of lowering cholesterol, LDL. What has it done? Where's the bang for the buck? What has it done to heart disease? I read to you an article the other day. Let me see if I can just get it quickly here again. Out of the Journal of American Medical Association Cardiology, 2024. Here's the headlines. U.S. death certificates related to heart failure, heart disease. Worse now than even 20 years ago. Worse now than ever. Well, holy smokes. If cholesterol was the problem, we've been lowering cholesterol. People are eating less meat today than ever. Did you know that? In some cases down in North America, down 30%. They're looking for love in all the wrong places. They want to create another test so they can put you on statin drugs. LDL, it really hasn't made much of a difference. But you know what the problem is? 99% of every physician is still indoctrinated. Cholesterol is the boogeyman. So now it's lipoprotein A, ApoA or ApoB. Let's get it tested because, we can look at your triglycerides and your HDL, which they don't. Or if they do, they don't, it doesn't mean nothing to them because that's controlled by food. If you want to lower your cholesterol, you can. Take a medication. It works. You will lower your cholesterol. Why do you want to lower your cholesterol? That has always been my position. Why do you want to lower your cholesterol? If you can convince me that lowering cholesterol will fix heart disease, then I'm all for it. I'm all for it. But you got to convince me. And it's just the opposite. It's the opposite of it. And that's why I get uptight about this whole topic. Okay. Mary. Dr. Martin, isn't it a consensus that cancer cannot survive in an alkaline body? No. Okay. Guys, let me go over pH very quickly with you again. Okay? You got pH in your blood. You got pH in your stomach. Okay? And the 3 pHs which you can measure. Okay? You got pH in your blood. You have pH in your stomach. And you have pH in your urine. Okay? Now you can do a saliva test in your mouth. You know what that'll give you for pH? Nothing. What does it mean? Okay. Now, we should do a whole teaching on this again. Just because it comes out all the time. Your blood, you can't change. Because it's so protected. So when you eat a piece of steak, okay, wait a minute. Who am I talking to? Mary. When you eat a piece of steak, okay? And, oh, that's acidic. So's a tomato. Are tomatoes bad? No. Okay? Let me just let's go back again. You have a piece of steak. You want your stomach to be very acidic to break that steak down. True or false? Yeah, you want acidity in your stomach. I mean, more than a lion, you want acidity in your stomach, right? And then when it gets to the small intestine, your body releases bile to change the pH. And your body releases sodium bicarbonate, baking soda. So steak isn't acidic. It's not acidic. It doesn't make you acidic. That is nonsense. It's not true. And so, yeah, I don't want you to be acidic, you know. Your urine's going to be acidic in the morning, okay? But as the day progresses, you want your urine to be more alkaline. I believe that. That's true. And that's for kidney function. But it's not for cancer. It's not for cancer. The vegetarians of the world, the vegans of the world have convinced people that unless you're eating fruits and vegetables and legumes and all that, you're eating acidic food. Like eggs are acidic. Cheese is acidic. No, it's not. No, it's not. It's not. Okay? It's not. Okay. Anyway, let's do a teaching on that because you guys ask me that all the time. And I think hold it. Let me just see here. Okay. Fashina. If you don't have enough enzymes to break down the food, will you gain weight? Possibly. Can this make you retain fluids? Would digestive enzymes help? Yes, digestive enzymes. I'm a big believer in digestive enzymes, especially as you get older. Okay? We just don't make enough of our digestive enzymes as we get older. And if you got any kind of digestive issues, digestive enzymes help you from this way. Probiotics help you the other way, both ways. Okay? Good question, Fashima. I think that's it. Oh, Tommy. Hi, I was just wondering how accurate the IgE blood test for it's accurate, but I don't. I be your own doctor. Okay, what do I mean by that? Because if you get an IgE test, okay, and it tells you, oh, you don't do well with eggs, I don't like that. Because sometimes I told people, well, that's not true. How do you feel when you eat eggs? Oh, I feel good. Well, then be your own doctor. You eat something, or even better to test, is eliminate something. Just, I wonder if I'm sensitive to lactose. Well, stop all lactose. 48 hours, 72 hours. And then introduce it again. And I got more mucus. Well, then that's a better test. Then no food. I've seen people with food sensitivities. It all comes back. I said, you can't eat anything. And then you're allergic to yourself too. Like I said, what are you going to eat? I said, okay, let's dismiss this and start over. Okay, what do you like and does it bother you? Yeah, I like this, but it bothers me. You know what I found generally too? If you fix leaky gut, if you take digestive enzymes, you get your stomach acidity back to 5.1 the way it should be, you do really well, and a lot of those sensitivities go away. Okay? Anyway. Okay, guys. I can breathe again. Okay, we love you. Thanks for all the questions. Keep sending in the questions, guys, okay? Because every day, really, we can do question and answer, I'll answer your questions. And we can do topics. But I do want to do some teaching. We'll do some teaching on pH. We'll do some teaching on, what else did we talk about today that we should do some teaching on? Say, Doc, let's do some teaching on that. Send us in your requests, okay? We love you. We'll talk to you soon.